Hi, everyone. Thank you for coming and spending your lunch here with us. It is my great pleasure to introduce Amy Hedrick, who is the CEO of a company that I personally really love, and we use their products every day. So the company is CleanBox, and if you've been to our demos, you see we have clean boxes everywhere. Especially after that pandemic, we have seen how important it is to make sure the headsets are clean in between patient use. So I'm excited for this talk. Thank you.
Thank you very much. Hi, everyone. Good to see you. Oh, I was hoping the music would play for that nice vibe. No, it's okay. Nice to see everybody. I'm Amy Hedrick, and for those of you who do know me, you're probably surprised to see me up here in jeans and a t-shirt, because I have never been to a conference of any kind in my life without being properly dressed and corporate clothes. But there's a reason that I'm doing this today, and I hope you can see what my t-shirt says. There is no planet B. No planet B. And of course, then I have this special pin, which is a little hard to see from all the way back there. But this is UN 17 Pillars of Sustainability. And these are goals and hopefully turning into pledges, hopefully turning into adoption and change of the way we interact with each other in the world. And the reason that this matters so much to my company, to our company, is because we are a sustainable hygiene company. We are focused on providing hygiene that is not only effective and repeatable, specifically in the XR space, will help it grow and scale so you can keep up and have a way to provide that user experience that is not only comfortable but also safe, but do it in a way that does not add to additional need for disposables, and do it in a way that's sustainable both with the product and the product life, as well as helping reduce what we end up putting in landfills. So hopefully you guys we can all agree at this point that this is important. I know in healthcare sometimes it's a bigger challenge than in other industries to have that focus when there's so much of dependence in many ways on disposables. But we're here to help all of you guys here successfully execute your XR programs and hopefully help you with this side of the entire setup. That means that I guess I will have to grab this. It will not move on its own. Let's see if I'm talented enough to figure this out. So what we're talking about today is foundations for safety and scalable XR in healthcare. And of course, you guys know that we're a hygiene company, and that's where we started. And I'll tell you a little bit about my origin story on this next slide. But we also focus on hardware management, which is on the logistics and operations side of actually building your pilot program. And then as you have great success, which I know you will, learning how to scale that and think about all of the logistics going forward that will allow you to do that successfully. So a little bit about me. That is me. Back in the day, and I guess I cut out the rest of the screenshot. This was a Facebook reminder 9 years ago at March, I guess a couple weeks ago, Mobile World Congress. I was at Mobile World Congress in Barcelona 9 years ago, and this was the first time I tried on this Oculus Rift. And I was writing at the time for a Hong Kong-based think tank about changes in technology, so I was there to explore everything that was going on in the world. And I don't even remember which pavilion this was in, but when I tried this on, what my Facebook post actually said was, what am I seeing? The future, of course. Because when I tried that on, what I truly found phenomenal was just thinking about it from a brand new perspective. I believed then, and I still believe now, that this tech has the capability of impacting the way that we learn, impacting the way children and future generations not only learn something new, but they retain that knowledge and they have a broader experiential base of that knowledge. And then, of course, that can transform education, and we're seeing it transform healthcare as well. And that's where I started. So I've been in the immersive tech industry, well, more than 8 years now, but let's just say 8-9 years. Just a little bit about some of the things that I do. We're a UVC LED company, so I'm very involved in the UV industry. I'm an expert in UVC LED engineering. I'm on the editorial board of UV Solutions. I work with many people here, VR, AR, XRA Healthcare Working Group. I chair that. And I'm also on both sides trying to help on the standards and lobbying side for this industry in general, as well as having a voice in there, because a lot of these standards groups, they're getting better, but when I first started doing this, they didn't have a lot of voices that understood XR or some of our specialties. So just to let you guys know, for those of you who have not met me before, a little bit about me. About CleanBox. So we're smart. We're a sustainable smart tech hygiene company. We're UVC LED. We started R&D back in 2016 to solve for rapid, consistent decontamination of hard-to-clean, frequently used devices. And we started with VR headsets because they are probably one of the more difficult pieces of electronic equipment to clean and to decontaminate. Of course, you've got electronics, you've got multi types of materials. It's not a simple object like a cell phone, for example. So, and then you have the fact that you can't expose it to heat, chemicals, and liquids, or you're not supposed to. And so that's what we focus on. And this is a little bit more about what we've been doing. Since then, we have over 70 global patents. We have 2 product lines. We have clients in about 50 countries, about 15 different industries, and you see some of our customers here. But why does this matter? So let me just see if I can figure out how to go there. Going back to this experience here. At this time, I worked quite extensively with a large educational institution in Washington, D.C., and the way this transformed what I was thinking was, wow, this institution has, what, 300, and I don't know what the current number is, 350 or 80 million objects. They can only physically display 1% at any given time. How else, what could this medium do that could provide opportunities for not only curators, content creators, to share more information, but for people, especially different generations that don't really want to read placards, and I'm kind of one of those. I know I'm not that young, but I still don't really enjoy going and looking at the little tiny fine print at the bottom of a museum exhibit. I don't feel like I retain a whole lot of information. I take a lot of pictures and don't read them later. But I really looked at this as a way that this could transform education. And to keep a long story quite short, I spent the next 18 months working on this very large deal, which in the end didn't exactly happen like we had hoped. But the first question that they asked me, they said, we're a federal institution. And again, this is 9 years ago, or 9 years ago. They said, how are you going to clean the headsets? I was like, oh, that's a really good question. And they were coming at it from a risk mitigation point of view. They said, we can't get sued. We have, tens of millions of people come through our locations every year from all around the world. And what you're doing is you're suggesting we put a personal device on somebody's face and then put it on the next person and then the next person. And that actually is why we started CleanBox. We were doing all sorts of things on the creative side and the content side as well, but understanding that would be a first barrier of entry. That was the very first pushback I got. It wasn't price, it wasn't what the tech can do, it wasn't is there enough content, it wasn't where's this industry gonna go, it's how can we protect ourselves from something we immediately see from all of our lawyers in this room as the first barrier of entry. So hopefully that helps you guys understand why I became so passionate in this space. So moving on, we're not just going to talk about our product, and hopefully if you haven't used it before, there's one of our products over here, which is part of a medical cart. A lot of products around at some of the booths, but we're also talking about why it's important to think about the hardware management when you're scaling. So if you look at this, of course, if you're here and you already have an XR program, I'm certain you've already walked through all these basic steps. You know who your target user is, you've planned training, which is also part of your planning for your successful deployment, and that's training both on the content side. How do you give your operators, if it's a nurse or a doctor or an administrator, how do you teach them how to use it, and then how do you monitor that? You've already known what your benchmarks for success are, you know who's going to pay for this or how you're going to get it through budget and which budgets you're going to have to tap into. And this is all very important for a successful deployment. Operational planning, infrastructure, hygiene, safety, and logistics, hardware management, software management, and training. And it matters, it's all connected in the end. So if the XR experience is not easily learned and properly managed, it's less likely to be adopted. If it's not easily adopted, it's not going to be repeated. And if it's not repeatable, it can't be scaled. And this kind of, I know this is super basic, and I know you all know this already, but I think it's really important to think about it because it's easy to get caught up, like I was originally, in the magic of the tech, because it is quite magical what we are able to do with it and what everyone in this room has been championing to do with it. But if you have this beautiful piece of art and nobody can do anything with it, you can't really scale that. That's not a success, it's not an industry, and it's not a disruptor or a game changer. So HMDs are personal devices, even when they're shared. So you can have a rollout of a deployment that has 1,000 headsets to start. They're shared, but they're personal. It sits on your face. And how that user feels, again, saying the same thing in a different way, but when wearing that headset, however it feels on their face, especially if it's the first time, if it's not a great experience, they're not going to want to do it again. Doesn't matter if you're, have the most beautiful tech possible, you're using whichever headset is your choice, whichever content you've created. This is all just as important as that. So ease of use, maintenance of XR hardware will also impact, again, not just the user experience. If you're creating something for a particular issue to address, a healthcare issue that you want to use on the patient, that's one person who's using this. The other part of that, which is equally important, is the administrative part. Because somebody's going to have to do that and help that patient know how to do that. And it's not going to always be the champion in the room. It's going to be somebody else who's been told, use this, do it this way, and think about all of this. And I can tell you, well, this is not new information, but there are two things that I find are consistently hard to, the biggest complaints I hear about in healthcare from the service side is not enough real estate and not enough time. And again, coming back to why does this matter? Hardware logistics. If you think through the time it's going to take and think through the entire process of deploying your experience, that will help adoption, which of course is critical for any kind of future success. Thinking about hygiene with HMDs, 42% of Americans are germaphobes. I think that's, I can't remember, I should have put the quotes up here. This is data that I can I can source. I have sourced. I don't know why it's not up here. But also, the other side of that is that 50% of us ish don't wash our hands after using the bathroom. Now, you don't have to raise your hand if that's you. Please don't, and don't shake my hand later. But that's an interesting combination of statistics there, and that means that a lot of us know that this matters, and a lot of us are not taking all the necessary precautions all the time. We get busy, we get lazy, we don't think about it for other things. But of course, I'm sure you also know this. This is right here, your triangle of death, right? Easy contagion transfer. So if I'm sick and I touch this device and you touch it and then touch your face, okay, that's a risk. But it's much riskier if I'm sick, I put on a headset, I breathe around it, I cough on it, whatever else happens, that's a much higher risk, which is, again, why thinking about hygiene is really important, not just in healthcare, but in any kind of use of XR. So what does CleanBox do? Well, hopefully you figured out by now that we provide rapid decontamination of these devices. It can be a VR headset, AR headset, any kind of immersive tech, haptics, and other things. We're UVC LED based. Is everyone familiar with UV? Anyone not familiar? So everyone knows the differences between A, B, and C. I mean, I know this is healthcare, but not everybody always knows, so I'll ask the question. So, yeah. Oh, God. Well, if you don't know, he's my COO, so I hope he knows. So it's different wavelengths on the UV spectrum, and I try to simplify it when I say, UV is, A is a sun, B is a tanning bed, and C is what is the most effective at decontamination because it's filtered out by the Earth's atmosphere. So it is very effective at disrupting the DNA and RNA strands of contagions, and when that happens, they can't replicate, so they can't spread around. Simplified, I'm sure you already knew that. But we focus only on UVC. We don't use A or B in our products. We don't use ozone, we don't use heat, and we don't use bulbs. And there are many reasons for that. Of course, sustainability is one of them. Also the fact that these are sensitive electronics. So if you're going to be able to scale something, you have to know that you're not going to damage the equipment in the process. When you think about heat or bulbs, there are many ways to think about UV. There's bulbs, there's mercury bulbs, xenon bulbs, a few other things. We don't use bulbs for many reasons. Some of them produce extra heat, many of them do. They can't be, you can't direct them exactly to where the surfaces are that you're targeting, so it's on a non-flat surface. It's going to be more complicated. And then, of course, it might require additional kinds of dosages and things like that that are also not great for electronics. We have 4 different products here, as you can see. One of them is right here, the OmniClean, which is our full 360 decontamination device, and that's of anything you put in it. So other use cases as well, which is important, things like we've tested on stethoscopes, cell phones, shared tablets, and other frequently touched handled devices. So again, some of these slides, maybe I put them in the wrong order, but planning for hardware management from storage and charging to hygiene and maintenance is just a critical a part of the adoption of your XR investment as the experience and use case itself. And I know I've said that in 5 different ways, but I want to reiterate that because I think it's really important to think holistically when it comes to our immersive tech. So a couple of our products, you just saw some of them. Hardware, storage, charging, and hygiene. So it's not just about decontaminating these products. Of course, that's critically important, but then thinking through that, how are you going to store them, charge them? How are you going to plan for that? If you're using 1 or 2 headsets in a lab, it's much simpler to do. Not too complicated problem solving there, but as, of course, all of you guys are going to take that and scale it, because that's the goal for most of these projects, is that you have to think about all these other logistics. So we help you guys do that. It's not a fun part, but it's a really necessary part, and we try to take steps to make it easier. We do custom products, as you can see. We also sell some of our core products that you can build into your own hardware. Lots of ways that we try to make this technology simple and accessible for whatever your use case or whatever your real estate limitations might be. And then this is our medical cart, like I mentioned. Now, thinking again, we're telling you all this, but at the same time, we're trying to also show you how can we make this easier. So this cart over here is, this one in particular is a collaboration with Mind Immersive. And what we wanted to do on this, or what is being used for, is employee wellness back of house. Could be used for other things, but the idea was to put everything in one section. You've got your headsets, which have the content on them. You have charging, it's a medical grade cart. You have storage capabilities, you can fit multiple headsets in there. You have a hygiene station, so you're not just thinking about, oh, I should clean the headsets, but you're also thinking about decontaminate, clean your hands. If you, depending on what your use case is in your protocol, you might need or be required to use other things as well. So again, this is our way of trying to help the process, make it easier, keep everything in one place so it's much simpler to use. Very hard to see here, but one of the things we do to help support that again is do an ROI report for you. So kind of impossible to see here, but our products last 4+ years with heavy usage. And our lights are certified for 10,000 hours of continual use, which you never get in the dosages that we give you. But what we do is we take and we say, listen, we're going to help also get this through budget, because that's a very important part of an XR program. How can we help you do that? Well, here's what we can do. We can show you what our products do, what they cost, tell us how many headsets you're using, how many locations. Then we'll give you advice. We'll say, okay, well, you don't really need a clean box for every single headset. You need one for every 10-ish or so. Then we'll suggest, here's your storage and charging cabinet, here's your point of use hygiene, and here's what it's going to cost you up front. Then we'll show you cost savings for the number of other types of, usually wipes of some kind, that you'll be saving, so fewer wipes that you'll be putting in landfills, as well as what the costs are for those, the labor and time required if you do decide to use some sort of chemical wipe, and how we can save you that time and money. And these are pretty high numbers. I don't remember which use case this is for, maybe a high volume use case, but any of you guys in this room, it takes about 30 seconds to do, so it's a good starting point. And then another thing that we've worked with, we work quite a bit with the VA, and I can tell you most locations have some variance in their protocol, their infection control protocol. It's not always the same, so it's important that we help the user and the healthcare system understand how we can build into your protocol. So for this one example, I think this one was for a healthcare I'm not sure which one this was, but they use, I think, Cavi wipes to remove any oil from the face, or and then run it through a system. Then we suggest, here's your protocol, hand sanitization. Some of them require afterwards you put it in a sterile bag. And so we help create these custom protocols with your infection control department, so it makes it easier, so everybody has all the same information, and it's a much simpler process. So I know this is hard to read, but again, afterwards, we're always happy to share some of this in readable form. I think I've just explained what CleanBox does, but just a couple of other things about us. Of course, because we ship around the world, we have a number of certifications. These are included. There are other certifications. We've done independent lab testing on all of our products separately on every part of the headset, so always happy to share those reports with you guys if you need them. And again, the goal is fast and effective. So let's talk about this really quickly. Fast and effective, repeatable results, no chemicals, liquid heat, or ozone, no bulbs, no replacement, etc. But fast and effective, again, is a really important thing to think about, because if you're going to run this through a number of users, even in a classroom setting, for example, if you're going to decontaminate headsets, that takes time, right? Anyone do this at scale right now? More than a few at a time, anyone? A few people out there, right? So as you probably know that depending on what kind of, if you're using like a chemical wipe or something manual, it's a manual effort, number one, so that's time, and the results are not going to be the same every time, but also the time it takes to use a wipe and leave it wet. There's a wet time required on surfaces. Depends on which kind of wipe you use, anywhere from 2 on the highly chemical ones that require hand, especially you're supposed to wear gloves with, to 10 minutes. And that is the entire surface that has to be left wet. So again, when you're thinking about scaling a program, this is why we're here, this is why we exist, to help you do this, to solve this pain point for you, so that it's much simpler. You do have to keep in mind the time that it will take to do that. I shouldn't have to point this out after a pandemic, but I think there are some of us that kind of got tired of thinking about the pandemic after we were all free to go our merry way, and we kind of didn't want to think about it again. And that kind of is a good reminder to say, by the way, this doesn't matter just because of COVID. This matters for all of the reasons that we get sick. All of the workforce, 2.5% of the US workforce, staying home every day with a cold and flu. Well, that's not just sickness. That's parents that go home to kids who get sick and share it around the families. That is expensive labor that is out of the office, out of whatever they're required to do. They're not working. And so you have to think about it in terms of the total impact, why this is super important. And then, of course, things that are frequently touched and shared. I might be very healthy. Maybe I'm a little tired. Maybe somebody else is sick here doesn't know it. So again, coming back to thinking about this as interrupting contagion transfer, which not only helps, of course, with your XR program, but just in general with your organization. I'm going to skip through some of this because I know I'm probably short on time. But kind of coming back again to limitations of non-UVC surface disinfection. So this is pretty basic and logical information. But as a reminder, of course, you can't use heat on everything, and that is, you can't stick a headset in an autoclave. It's not gonna, or you don't want to buy a new headset every time you use it. Even I've heard some surgical companies, I don't think anybody here, but previously talking about using a headset for surgery prep. What do you do at the end of the day? And this was not an inexpensive headset. Well, right now we're suggesting that they throw the headset away after surgery. Now. Okay, if you threw that away and you had that in your budget, good on you. But that's not sustainable, and that's certainly not repeatable, and that is absolutely not scalable. So again, thinking, because I have the vision, I'm sure everybody here does, you're going to grow beyond this room, beyond whatever you're using right now. That's the whole point, right? Might take a long time to disrupt these kinds of things that we're doing, but that's the goal. So then, of course, lingering chemical traces. We all know what that could do. Sensitive skins, allergens, immune suppressed. And so these are the limitations of non-UVC surface disinfection. We just talked about this in terms of wet contact time, but I'll say it again because probably you guys are much more educated than people in other industries about this. But of course, if you do use wipes of some kind, they require wet time, and you have to leave it wet. And it's challenging to do. It's challenging even to do it on a hard, flat surface. It's impossible to do it on things that are porous, more porous surfaces, even if that porous surface is a plastic, for example, which is still a porous surface. So of course, it's untraceable for compliance, expensive, and wasteful, and not designed for these types of products. They're designed for hard, flat surfaces that you can leave wet and that you don't put back on your face. Repeating this, of course, the goal is to be able to use those headsets over and over again, not damage them. Many of the warranties, of course, will be voided if you do use things like alcohol wipes. Not good for plastics, doesn't work on fabrics, and not supposed to use them on lenses either. And again, wasteful and generating millions of tons of waste. That doesn't mean I'm saying here, don't ever use a cavi wipe. But I'm saying that there's a place for that. And there's also a place you can build that into your protocol, but understand that there are better solutions, there's better ways to do this that are going to keep the life of your headset, because that's not just a headset, it's an investment. Someone paid for that, someone fought to get it through your budget, and someone needs to use that again. So again, thinking holistically about the entire ecosystem. And of course, we believe this is a complementary product, whether using it in a, let's just say in your waiting room, so it's less invasive, or it's actually in a patient room and directly on a patient in a bed. Our goal, what we are, sustainable hygiene. So quickly I'll go through how this product works. So like I said, we use UVC LEDs, very different than bulbs, and think of it this way. Take a flashlight and point it at the wall. I don't have one here, but let's just say I did. We all know that if I pointed at this spot, that spot would be very bright, and then everything around it, you'd start to see that light dissipate, right? That's just kind of how light works. So what we were able to, so if you think of a bulb that way, because there are UV bulb boxes, you think of a bulb that way, it can be, you can have a high output, but you can't design a bulb unless you're putting it all around the box, and then those are other issues. But it doesn't have the same capabilities that LEDs do. So what we have is we have designed our products to have an overlapping radius of light through our LEDs. So they're LED grids that are able to target complicated surfaces that are mixed materials and non-flat. Obviously, there are other advantages of that. We use the 265 wavelength. It's highly effective against a broader range of contagions than some of the other wavelengths on the UV spectrum. And then, of course, there are ranges of LEDs now, 265 to 275. They're energy efficient, and again, great for small spaces. Precision targeting is something that we do, and these are just a couple diagrams to show you how we've done precision targeting in some of our products here. Reflectivity is an important part of some of our products. These is just some test examples we use. And this OmniClean over here, we use a PTFE, which is a Porex surface, and it's highly reflective and refractive. So some of the testing that we do outside of our lab testing and so on the R&D side is determining what the cost value proposition is for various types of reflectivity and how that might increase our output or make our dosage, a consistent dosage, accomplishable in shorter amounts of time. And then kind of coming back to precision targeting, this is this machine over here. So you can see lights top, bottom, sides. There's a rotating quartz plate in this because the UVC can get through the quartz plate, cannot get through the acrylic. But it's coming up from the bottom. And so again, you're seeing here the ability to have broad coverage over complicated surfaces by using the engineering that we do. With that, I know I've said a lot, and it's probably at time. I don't have a watch, so I have no clue. Are there any questions or anything in the room? Yes?
Are all your machines single-unit machines, or do you make a bigger multi-head unit at a time?
Yeah, so the question was, are all of our machines single-unit or multi-unit? And we have both. So, and one thing to think about it, and I don't know if I mentioned this, but our products are 1-minute cycle times. We reach about a log 5 kill on a range of viruses and bacteria in that 1 minute. We can share which of those viruses and bacteria and all of that with you. But with that, just to keep in mind, even our smallest unit, which is a single one, if you run a full minute, it's about 50 an hour, 50 headsets an hour. And then, of course, there's a double one, there's a 4 times one. But we found that a lot of people, what they really need at that point of use, because you're using it between every user, right? If you've got a minute or 2 minutes, that's good enough. And then if you want to store it in the back, our charging cabinets also have some additional UV. Yes?
Amy, thank you for providing the clean box to this event. I feel so much safer trying out all these different assets.
My
Just a
pleasure.
quick question, why is sustainability important to clean box?
Well, the question, why is sustainability important to Cleanbox? It's important to me personally, but it's also our corporate mission. And that is because I do believe that what we put out in the atmosphere and in landfills, it really matters. Sustainability is also important, again, when it comes back to scaling, because you have to think long-term about what's going to be the most successful and what's going to cause the least amount of waste. If we can help reduce, again, it's not just wipes, it's other types of disposables, help reduce, we don't have to change any bulbs in our products, for example, so that's one other value proposition there. And that's why it's really critically important. And I know I'm out of time, so thank you, everybody, for being here today. I hope you had a great lunch.
Thank you for that talk. That was great.